A GP is everyone's family doctor and everyone's first point of contact. As family doctors, it's our duty to raise awareness of important health screening topics to our patient, one of which is breast cancer screening. So as a family doctor, whenever I meet my patients who are eligible, who are the right age, I will tell them, hey, you know what? It's time for breast cancer screening. You have not done one yet. Will you consider it? And don't be afraid of it. It's actually effective, it's safe, and it's accurate. I try to broach to them every time I see them and every time I have opportunity to do that. But with the launch of Healthway SG this year, I'm really happy because now there's an opportunity to formally talk to our patients about screening or taking charge of their health. And with the Healthway SG, it's fully subsidized for eligible female patients, and they're really happy to be given this opportunity to have a free screening. And I'm happy to report that with the new Healthway SG workflow, screening appointments are much more easy now. You just have to scan a little QR code or just key in a little data, and the appointment and the information goes to the patient directly, and the patient can go for screening at the timing of their choice. A lot of the patients have this misconception that the screening is very painful, it's not effective, it can cause harm to you. So as family doctors, we try our best to explain to the patients, while it may be a bit uncomfortable, it's not truly painful, and it's scientifically proven that regular breast cancer screening can save lives by early detection of breast cancer. Very recently, I have a lady who came in for Healthcare SG consult, and she's 60 years old and she never had a breast screening for her entire life. So when I told her about it, she was very surprised that there was such a thing. So when I explained to her the roles and the benefit, and that it's not as painful as you think it is, you should go for it, and she went for it. Unfortunately, they detected a small lump during this screening, and she's very thankful to NUHS because in a very short matter of the time we got the mammogram, she had a very quick appointment and she underwent a biopsy in a very short period of time. Very thankfully, I just received the report today and I called her up to let her know that it's actually normal, and she's really happy and relieved because she was planning for a big holiday and she was under this cloud that it might be something scary or something bad. And very thankfully, due to the speedy work of all our colleagues at NUHS, we got the biopsy out really quickly, and she's very relieved that it's normal. And she told me she will tell all her friends to go for breast cancer screening, and she'll regularly go for her screening. So sometimes we do realize that patients, when they have a negative result, they have this false reassurance that they are well, they don't need further screening. So that's where they have regular family doctors who see them year after year, can remind them that, hey, you're due for a screening again, and this rescreening is actually more effective. In fact, screening is most effective when it's done regularly and at the correct intervals. So as family doctors, it's very important for us when we meet our patients who are eligible to remind them that they're due for a breast cancer screening and they should go for a follow-up screening. At Healthway Medical, we view screening very seriously, and we are very supportive of Healthcare SG and the Breast Cancer Awareness Month. So in our regular teachings, our interactions, our internal trainings, we do remind them that when they see eligible patients, especially female patients with family history or at high risk, they should seriously spend the extra few minutes to discuss with their patients and convince their patients to go for breast cancer screening, as regular screening, especially in high risk group patients, can save lives.